Hey guys, I'm back. Another video for you guys. We're going to continue talking about hyperemesis. This one will be on 10 treatments for hyperemesis. So, jumping right into it. Okay, let's just paste that back. Alright, so we're just going to throw it out. Alright, so we're back. As I was saying, 10 treatments for hyperemesis. So like with diets, workout routines, and clothing, there is no one size fits all. Treatments for hyperemesis will be trial and error until we find something that works for you. So something that may have worked for someone else may not work for you. Okay? So let's begin by talking about the mental health aspect that can be affected with hyperemesis. It can be hard feeling like no one understands what you're going through, and you might feel alone, very alone. Now, this is normal. This is typical, especially not just for hyperemesis, for anyone dealing with any type of disorder or any health issues. This can be a lot on the mind and the mental health itself. Hyperemesis can be so severe in some women that it can literally affect every aspect of your daily living. So this can affect everything from you won't be able to go to work. Some women aren't able to even get up to just hug their children. You can be affected by financial burdens because you're not able to work. Emotionally, you may be struggling because you can't even care for your family. It's easier said than done, but please try to avoid stress. So one of the treatments mentioned here in this video would be seeking a psychologist or someone that can help you deal with these emotional issues if you can't find help through your family or through your friends. So the next treatment we want to talk about is diet. So changing your diet from having maybe a breakfast, lunch, and a dinner, have smaller, more frequent meals. This is going to help ease the tummy so that it's not too full, and just so that it's not confused or battling between it digesting the food or rejecting it. Also, having more proteins in your diet. Also eating more carbs and less fats will also help. Drinking electrolytes like Gatorade or Pedialyte, things like that, vitamin water, and also avoiding any foods that you find personally trigger your nausea. The next treatment will be IV fluids. So this will happen in the hospital. You'll just be pumped basically with 1,000 bags of IV fluids. So this is going to rehydrate the body, like I talked about, I believe in the beginning of the video or in my past video. You're severely dehydrated with hyperemesis, so we just want to replace that fluid volume, build the body back up to its equilibrium, to its natural working state, and just have everything functioning. We want to make sure the baby's good. We want to rehydrate the baby as well, things like that. The next step will be electrolyte replacement. So the most important electrolyte, mainly for the heart to prevent heart attacks and things like that, would be potassium. So in the hospital, along with your large 1,000 ml bags of fluid, your nurse will also hang something we call a K-rider. It's just little bags of potassium that we attach to the IV fluid line. That's just going to replace all your potassium. You could be given also like sodium tablets, just a bunch of different types of like tablets or little IV bags that'll just replace all of those electrolytes that you're losing through your vomiting. The next one would be replacing your vitamin B. So that's your vitamin B1. This can be in also some small IV bags. It'll be hung maybe within 30 minutes. It'll go through, and that's that. So treatment number 6, this is your antiemetics. So this is your anti-nausea medications. So this one is going to be the main one that's going to be your trial and error, because there are several anti-nausea medications. They're all IV. They go right into your IV lock. Like I said, there are several of them. Some may work better for others than others will, if that makes sense. So the typical antiemetics used are your Reglan, your Zofran, and your Phenergan. Like I said, they'll start with one over the other depending on just a bunch of different things, and if that doesn't work, we'll try another one, and then so on and so forth. So the 7th treatment, this is your steroids. Now this is probably the last resort. This is used for more severe cases. So I have seen a few cases of women who have completely ceased vomiting with just 1 dose of IV hydrocortisone, which is one of your steroids. Moving on to the 8th treatment, this would be your ginger. So we've heard a lot about ginger, whether it's from our parents, our grandparents. It can go back for generations. It's helped plenty of sicknesses and illnesses. So here, the ginger obviously is supposed to help the nausea. So I've found some research in a study done with women, obviously pregnant women, with ginger versus a placebo. A decrease in vomiting was seen in women treated with the ginger. So the 9th treatment would be acupuncture. This is another one. Like ginger, it goes back for generations, and it goes back to your Mayan and Aztec times. They've used acupuncture for several illnesses and basically anything. Another study done with acupuncture versus a placebo, again like with your ginger, vomiting, there was a decrease in vomiting also seen with acupuncture patients. Fun fact, acupuncture is known to have an effect on the GI system. So the 10th and final treatment for hyperemesis, a little bit unconventional, hypnosis. But according to my research, the way it's broken down, it does make sense that this could help. So this works in 2 ways. The first one is relaxation. So your hypnosis person is going to help you to relax the hyperactive state of your GI system. So the hyperactivity, the craziness, the wanting to throw up and vomit all the time, that's the hyperactive state of your stomach and your overall GI system. The second way is going to be removing the actual symptoms, the nausea and the vomiting, all those things, with the process of the hypnosis itself. So all of the treatments I've discussed, some of them, most of them, they're going to be used during your hospital stay. You can use them at home to try and see if this can help you before you need to be hospitalized. But overall, these are the treatments that are usually recommended, usually tried during your pregnancy. You're going to be dealing with hyperemesis usually throughout your entire pregnancy. You got to try some stuff, right? We want to resolve the symptoms, resolve the overall trauma it's causing to the body and eventually to your baby. So keep in mind that though all of these treatments are being used, you won't be discharged from the hospital until they find a regimen that's going to work for you, treat your symptoms, and try and keep them at bay. And also these treatments will be used upon discharge, so they won't discharge you unless they, like I said, find a regimen for you, and the regimen you're able to continue at home. Also, you won't be discharged until you can also tolerate like a full meal. It doesn't have to be like a big thing like a cheeseburger with fries, but they'll start you slowly. They'll start you with like drinking some fluids. If you can tolerate that, then they'll start you on like maybe they'll make you try some crackers, and they'll just kind of like titrate up your diet from there until you can tolerate some like a small meal, like a soup with like a water or something like that. Alright guys, so that is the end of the video. That's what I have for you today. I hope you enjoyed it. I hope I was able to help someone out there with hyperemesis or morning sickness. These things can also work. Some of these things can work for morning sickness as well. If you liked it, please like the video, subscribe if you want to see more of my videos coming. I'm going to touch a little bit more upon hyperemesis and a couple other videos after this, so please look forward to that. Again, thanks for watching my video, and see you guys.